Hi, my name is Lauren Brewer, and this is my final nursing 612 head to toe assessment. This is my patient, Stephen Brewer, who has agreed to be my patient for this video. Before we got started, I got a full set of vital signs, including height and weight. Stephen emptied his bladder, and then we test his vision using the Snellen and Rosenbaum chart. Snellen for distant vision and Rosenbaum for near side vision, and his vision was 20/20 in both eyes. Which tests optic nerve number 2, which is the cranial nerve. Next, I'm just going to take a look at Stephen's head and his skull, noting the symmetry in his skull. His head is atraumatic. His eyes are midline, and his ears are symmetric to his head. Next, I'm just going to palpate his skull, noted for any lesions or any tenderness in his skull. His hair is of a black, coarse texture. There's no excessive thinning, or there's no areas of baldness that are noted in his hair. I'm just going to move down by palpating the facial bones, noted for any tenderness in his facial bones, and there's no tenderness with palpation. Next, I'm just going to palpate the TMJ. Keep open up, close. Just noted for any clicking in the TMJ joint, which there was none, which is a normal finding. Next, I'm just going to palpate the sinus region, palpating for the frontal and maxillary sinuses. Just palpating for any tenderness that may be noted in this sinus region, or any swelling, which can be an indication of sinus, which it was negative on exam, which is a normal finding. Next, I'm just going to test his light sensation. So I just need you to tell me when you feel, close your eyes and tell me when you feel this on your forehead, cheeks, and chin.
I feel it. I feel it. I feel it. I feel it.
All right, light sensation is intact around his face. Next, just moving down to his eyes, I'm just going to do a basic inspection of his eyes, just noted for symmetry, any swelling, any drainage, which there is none noted. His eyelids are of a normal shape, and they curve over his eyeballs, and his eyelashes curve away from the globe, which is a normal finding. Just looking at the eyes, on the inside, there's no redness noticed in the eyes. Next, I'm just going to examine the conjunctiva and the sclera. I would normally use a pen light. My pen light is missing at this time, so I'm just going to flash this light in your eyes. Can you just look up for me? Going to pull down on the eyelid, noted the conjunctiva, which is of a pink, moist color. There's no excessive drainage or exudate that is noted. And I'm just moving in to look at the canthus as well, which is of a normal finding, and I would do that on both eyelids, noting the color of the conjunctiva, and then the sclera is of a normal white color with some blood vessels noted, which is of a normal finding. Next, I'm just going to perform the cover-uncover test. So I'll have you take your right hand and cover your eye, uncover. Left hand, cover your left eye. Right, there's no strabismus noted and no fixation, which is of a normal finding. Next, we're just going to test cranial nerves 3, 4, 6, oculomotor, trochlear, abducens by doing the 6 cardinal fields of gaze. So I'm just going to hold your chin, and I need you to look at me, open your eyes, do not move your head straight. Put your head down, straight, and I need you just to follow my finger with your eyes. All cranial nerves 3, 4, 6 are intact by doing the 6 cardinal fields of gaze. Next, I'm just going to move to the ears. First, just inspect it for symmetry. His ears are symmetric to the rest of his face. Next, I'm just going to palpate the auricles down to the pinna. Just noted for any tenderness, any external swelling that might be noted, which there is none. Next, we're just going to check the hearing, and we do that by testing cranial nerve number 8, which is the acoustic nerve. We'll start by doing the whisper test. So I'll have you take your left hand and cover your left ear, and I just need you to tell me what am I whispering?
A, B, C.
Good job. And then do the other side.
A, B, C.
All right. And his hearing was intact bilaterally on each side. Next, we're just going to test hearing with this tuning fork, which is called the Rhine test. So I'm just going to strike this fork, place it on the mastoid bone. I need you to tell me when you stop hearing the sound back here, and then I'll move it in the front, okay?
Okay. It stopped. It stopped.
And then we'll do the same thing on the opposite side, just striking this fork.
It stopped. It stopped.
All right, so his bone conduction was 10 and his air conduction was 20, which is a normal finding. Air conduction should be greater than bone conduction. Next, I'm just going to take the otoscope again, and this time I'm just going to examine the inner ear by going up and back. Looking at his ear, I am able to note the bony landmarks. I'm able to see the auditory canal, the tympanic membrane, which is a pearly gray color, and I am able to see minimal cerumen. There's no other different color drainage or swelling that's notated in the ear, which would be some type of sign of an ear infection or something of that nature. And then his hearing was intact bilaterally as well. Next, moving to his nose. His nose is symmetrical. It is midline of his face. His septum is midline to his nose. I'm just going to test the patency of his nostrils by having you occlude one of your nostrils and sniff in, and then the other nostril sniff in. And he was able to do that effortlessly as well. Next, we're just going to test cranial nerve number 1, which is olfactory, just by closing your eyes, and I need you to tell me what this familiar scent is. Smell it. What scent is that?
Vanilla.
That's correct. It's a vanilla candle. Next, I'm just going to take the otoscope again, and this time I would be examining inside of the nose, looking at the terminates, which are present, the septum, which is midline, and also just noted for any drainage, any lesions, or anything in the nose. The nasal mucosa is of a pink, moist color. There's no excessive swelling or polyps that are noted as well, which will indicate like a sinusitis or abnormal finding. Next, just moving on to the mouth. First inspected his lips. His lips are of a pink color. There's no lesions present. There's no excessive swelling on the lips as well, which is a normal finding. Just open up your mouth. So he has all his teeth present in his mouth. He has a pink oral mucosa that is noted in his mouth. Can you stick out your tongue and say ah?
Ah.
His uvula is present and his gag reflex. His uvula is midline and his gag reflex is present. You close your mouth. Looking at the oral pharynx, everything is pink moist. There's no lesions. His gums are of a pink color, and his pillars are pink as well. There's no swelling. His tonsils are actually out as he's had a tonsillectomy at a young age. And there's no other abnormal findings in the mouth. I looked on both sides of his tongue, noted for any oral cancer. There were no lesions present. And then I also looked at the ventral side of his tongue, and it was moist with no lesions present as well. Just moving down, we are going to move on to the neck, just doing a basic inspection, looking for symmetry of the neck, any swelling that is noted to the external neck area. His neck is of a smooth surface, and it is normal and midline to his head. And then we're just going to palpate for the trachea to make sure it is midline. His trachea is midline with no tug present. Can you swallow for me? Just palpating for the thyroid. The thyroid is present as well. Next, I'm just going to palpate each side separately for the carotid pulse. And I feel his carotid pulse. It is 2+, which is of a normal bounding pulse. And then this side, pulse is of a 2+ on this side as well. Next, I'm just going to check his range of motion in his neck. So, Steven, can you take your chin and touch the bottom of your neck, of your chest? Any pain?
No.
There's no pain noted. And then I'll have you extend your neck back without any pain. I'll have you look to your left and look to your right. and he is able to move throughout the range of motion, which is a normal finding. Next, I am just going to palpate for his lymph nodes. First, I'll start with preauricle, postauricle, occipital, tonsillar, submental, submandible, superficial, posterior, deep, and supraclavicular. And while palpating, I'm palpating for any swelling to make sure there's no lymphadenopathy, which there is none, which is a normal finding. Or also palpating to see if the patient has any tenderness, which he has none. Next, moving along, I'm just going to auscultate the carotid artery and also auscultate the thyroid, checking for thrills and bruits. So I'll do that with the bell of my stethoscope. First, auscultating the carotid artery. And there's no thrill that's present. And then the thyroid. There's no bruit that is present either on exam. Next, we're going to check cranial nerve number 11, which is the spinal accessory nerve, by doing a shoulder shrug. So I just need you to lift your shoulders up. And he was able to lift his shoulders up as well. Next, before we do the extremities, we're going to go back to the face, noting for the facial cranial nerve muscles as well, which is cranial nerve number 5. Can you clench your teeth together? Can you poke out your cheeks? Can you frown? Can you smile? Can you wrinkle your forehead? All right. And he was able to do all of those things, which is cranial nerve number 7, the facial nerve. Next, when we tested his tongue, also, can you stick your tongue out and move it side to side? We were testing for the hypoglossal nerve, and then speech has been cleared throughout the exam, which tests for the vagus nerve as well. Next, moving down to first his upper extremities. So just noting the skin, which is of a smooth texture. The color is uniform and even. And his temperature is of a warm temperature, which is a normal finding. He's not cold or abnormally hot. Next, I'm just going to check pulses on both sides. Pulses are 2+, and then check pulses as well. Normal 2+. Next, I'm just going to check cap refill. His cap refill is less than 2, which is a normal finding, which means he is oxygenated well. There's no clubbing noted to his fingers, which would indicate some type of respiratory issue. Next, just move it down to the lower extremity. Uncross your legs for me. So both of his legs are of a smooth tone. There's no open lesions or wounds present. The temperature is warm. There's no edema noted. I'm just going to remove one of his socks. There's no edema noted in his legs or in his ankles. There's no swelling noticed. Just going to palpate for the dorsal pulse on his foot. And it is of a 2+. And then moving into the inner ankle behind the malleus bone, just palpating for the posterior tibial, which is of a 2+ as well. And then I'll just remove your other socks so you can have both socks off. And then I would do the same thing on this side. No ankle edema, dorsalis pulse, moving inward to the posterior tibial pulse as well. And there's no swelling in his ankles, which is a normal finding. Moving on to the chest, we'll do the cardiac assessment. Moving on, actually, we're going to do lungs instead. So just noted his chest area inspection, basic inspection. There's no barrel chest. The rise and fall is symmetrical of his chest. His AP diameter is 1 to 2, which is normal. I would usually watch his respiratory rate for 1 full minute. I would not tell him I'm watching, but normal respiration should be somewhere between 12 and 20. And he appears to be around 16 somewhere. Next, I would just palpate his chest, noted for resonance. Also, while inspecting his chest, there was no adventitious audible lung sounds heard, like rails or crackles that I could hear audibly, and he's breathing unlabored and effortlessly. Next, before I palpate for resonance, I'm just going to check for tactile firmness. So I just need you to say 99.
99, 99, 99.
And tactile firmness is intact on the anterior chest. Next, I would just be palpating, and I'm palpating the lung fields for resonance in all lung area. Anything outside of resonance would be considered an abnormal finding. And it was all resonance on the anterior surface of the chest wall. Next, I would just also take the lung sounds, comparing side to side, just listening to all the lung fields. And his lung sounds are of a clear, unlabored rate and rhythm. There's no crackles or adventitious breath sounds that are noted. Next, I would just percuss for the lateral sides as well, just comparing each side, looking for resonance. So I'll just have you put your arm up, and I would just palpate down, and it's resonance heard on both sides. I would do the same thing on the other side. Don't lean. Resonance heard as well. Next, I would just do a basic inspection of his chest. If he had on a gown, I would lift this up, just inspect the back of his chest wall. Rise and fall is symmetrical as well. First, I would do the same thing with percussing all the lung fields, making sure that I hear resonance in each lung field. Hyperresonance would be an abnormal finding. Next, I would measure the diaphragmatic excursion. The way I would do that would be at the right mid-clavicular line. I would have you take a deep breath in, exhale out, and I would percuss down to dullness, and then I would mark it, and then I would percuss up to resonance, and I would mark it. I would measure that mark, and that mark is 4. Normal diaphragmatic excursion is usually anywhere from 3 to 5 centimeters. And then I will auscultate the posterior chest, comparing each side to make sure that there is no adventitious breath sounds that are noted. And right now they are just clear lung sounds. Next, moving on to the cardiac exam. So basically, we would just first check for the apical pulse, and the way I would do that is by going to the left 5th intercostal space mid-clavicular line, just palpating at the PMI, and there is a normal 2+ pulse that I am able to feel. Next, I would just auscultate the different areas of the heart, going for aortic, pulmonic, herbs, tricuspid, and mitral. And I would listen for a full minute. There was a normal S1, S2 heard. His heart rate was about 68 beats per minute, which is normal. There were no murmurs that were heard on auscultation. Next, I would just palpate at the aortic base for any pulsations, thrills, or heaves, and there's none that are noted. Next, I would just have him lay back, and we would do the abdominal exam. So I'll just have him lay back this way for camera purposes. So first, I'm just going to do a basic inspection of his abdomen. And his abdomen contour is a nice shape. There's no excessive swelling that I can notice in his abdomen. Can I just have you lift your chin up to your head? Just trying to note for any, you can lay down, any herniation. There's no hernias that are noted. And then next, I will start by just auscultating the abdominal area noted for vowel sounds in each quadrant. And his vowel sounds are of a normal active rhythm, which is a normal finding as well. Next, I will just palpate his abdomen, palpating light 1 to 2 centimeters first, just palpating each quadrant, checking for any tenderness, any masses, or rebound tenderness, which he has none. Next, doing a little bit of a deeper palpation checking for the same thing, just a little bit more deeper, feeling for the organs now. Then next I will palpate at the right costal mark for his liver border. Can you take a deep breath in? Let it out. And I'm able to feel a smooth liver border to the right. And then I'm able to palpate over for the spleen on the left costal margin. And I'm not able to feel the spleen, which is of a normal finding. Next, I'm just going to percuss up for the liver as well. So I would just do that by just percussing up to tympany. And then I would usually mark and then percuss down to dullness, and I would mark as well, which would give a adequate size of the liver, which should be about 6 to 10 centimeters. His was about 7. And then I would also percuss on the left side for splenic dullness around the 5th rib. Splenic dullness is a normal finding. And then actually I would go back because I didn't auscultate for the aortic artery. So I would do that first with the bell of my stethoscope. And then I would auscultate for the renal arteries as well. The iliac arteries and the femoral arteries. Next, I would palpate for the kidneys. The way I would do that is just right under the flank area. I would try to palpate for the kidneys on the right side, and then try to do the same on the left side as well. And I was not able to palpate his kidneys, which is a normal finding generally. Next, I would just have him sit up. And then I would just have you sit straight up just like that. And then I would check for costal vertebral angle just to make sure there's no pain noted. Do you feel any pain?
No.
And there's no pain on exam, which is a normal finding. I'll have you turn around now. And then next I will just test his reflexes. First starting with his brachial reflexes. Just let your arm relax. On both sides, let your arm relax. And then I'll do his popliteal reflexes. And then his Achilles reflexes on both sides. And then also just checking for pulses, popliteal pulses as well. Next, I'll just check his sensation kind of with dull and sharp. So I just need you to close your eyes and tell me where I'm touching you and tell me if it's dull or sharp.
Forehead, dull, sharp. Sharp arm, bicep.
Okay. And then?
Dull, calf.
Okay. And his sensation is intact. The last thing we'll do is I'll have you stand up and we'll just check. I'll have you bend over and touch your toes. And I'm checking for his curvature in his spine to make sure he doesn't have any scoliosis that is present, which there is none. I'll have you sit up. And then I'll just have you lean back, stand up and lean, just stand up and lean back, checking for cervical extension, which is normal. And then I'll just have you do lateral rotation by moving side to side, which is normal finding as well. You're good. That concludes our nursing 612 final head to toe assessment. Thanks for watching.